Okay, this is part two of a lecture looking at the beginning of the course of effective therapy and healing in a diverse world. We just got done talking a little bit about the idea of conformity and effectiveness. Now let's talk a little bit about some different ways of thinking of effective healing. Um, Effective healing beyond the vaulted norm. The vaulted norm is a phrase that I take from Ed Mendowitz. That Ed Mendowitz will talk about this in a very similar way to how I've been speaking of it. And he'll talk about it in terms of the bell curve that we often see in psychology. And we'll say that what we normally are trying to do in therapy is we're trying to take someone that may be on the outside of, the bell curve. Let's see if I can draw this here. And so this is normal. And maybe there's someone out here that is struggling a little bit because they're out here. And what we need to do, and what psychology generally tries to do, is move this direction. Now what Ed Mendowitz will say is maybe what we need to do sometimes, at least, is help them move out further to be themselves. I would maybe put it in a little bit of a different way, that I think we need to help clients think through where they want to be, think through the consequences of being in the norm versus the consequences of being outside the norm, and help them make the decisions about that. But the point is that we need to conceive of healing in broader ways. So there are other ways that we can conceive of it. Well, this is one right here. Helping individuals make the choice about where they want to be and then helping them achieve it. That's one way. But we can also talk about different things such as spiritual. Now, spiritual doesn't necessarily conflict with the more traditional ideas of effectiveness, but sometimes it does. For example, if you look at most of the major world religious and spiritual traditions, you will see that there's a call for suffering that's often in these, where it will be said that, for example, in the Judeo-Christian tradition, it will often be said that if you follow Christ, well, then there will be suffering that comes from following Christ. In the Buddhist tradition, one of the Four Noble Truths is that life is suffering. And so from a spiritual perspective, suffering is considered part of being human. It's part of life, and it's even part of being spiritual. Now, there are spiritual conceptions. These are often ones that have maybe moved on or moved away from the traditional understandings within a lot of their spiritual traditions, in which happiness is something that's seen as a primary part of that religious or spiritual tradition, but not necessarily so. So maybe in helping people seek a spiritual health, a lot of times we may be helping for them to be comfortable in the midst of their suffering, in the midst of their challenges, because of this greater spiritual meaning or value to this. Similarly, meaning is another way of looking at health. And this, as an existential therapist, this is one that I particularly value, that meaning as being the primary end. And Viktor Frankl even talked about that happiness becomes more elusive when we seek it directly, and it is something that is better understood as a side effect of a well-lived life, of a meaningful life, of an ethical life. This is something that personally I find very attractive. That the pursuit just of happiness, not that I have anything against happiness, but the pursuit just of happiness often is problematic. And for me, that's for two reasons. One, because of as Frankl says, I question whether just seeking happiness is often very effective in achieving happiness. There's other things that often are more helpful in helping the person live a happy life. But second, because I think happiness isn't always the best end. But let me add in there, and I think this is very important for people that may have a similar perspective to what I do. It is not our choice. It should not be our choice about what the client seeks. But if we're in the role of healer, whether it's therapist or otherwise, one of the things that that we can help the individuals that are suffering do is choose what type of end they want with awareness of the different possibilities. Rarely does that happen today. Rarely does someone go into therapy and the therapist say, well, there's different ways that we can approach this. We can try and alleviate your symptoms. We can try and increase your happiness. We can try and help you find deeper meaning, and that often leads to happiness, but it may or may not. We can help you become more aware. We can help you grow in these various different ways and see if that helps you become more happy. Rarely does that happen. And obviously you don't want to talk about it just in the way that I'm presenting it there. But we do want to help people start to ask these questions and think about other possibilities, because too often individuals that are suffering and want a change in their life, they don't have the resources to really think about, well, what are the different possibilities? What are the different options? They're just aware of the ones that are so popular in our media, whether it be entertainment or the news or wherever. There's often these implicit assumptions about the type of life someone should seek and the way that someone should be. Growth. And a lot of times people seek healing just through growth, through becoming a better person or growing in different ways, spiritually or otherwise. The ability to embrace emotions. This too, from an existential perspective, is one I really value, is that a lot of people have learned to be afraid of their emotions. And if we can help them experience their emotions differently, then their emotions aren't such a bad thing. That in my own experience, I grew up in a background that anger was seen as a bad thing, and it was seen as something that you should want to avoid, that you should try and stay away from. And so I had a pretty pathologized view of anger for much of my life. And then as I was around people from different cultures that had very different ways of facing anger, I started to realize that there's a lot of limits in the way that I understood and approached anger. And now I'm able to experience anger a little bit differently. It's still a bit of a struggle to me. I'm still not someone that typically enjoys the experience of anger, but I do experience it a lot differently than I used to. And of course, there are some anger, there's a variety of different types of anger, some that are more problematic than others, some that may be a defense against sadness, some that may be misused. But if we can help people become comfortable with their anger, then they can start to respond to it in a different way. Similarly, if we can help people become comfortable with their anxiety, we can help them start to respond to their anxiety in a different way. So the ability to embrace emotions and to experience emotions differently, I think is really key here, to experience them differently. Those can be very helpful. Self-awareness, psychodynamic models in particular emphasize this. But I would say it's also true of many of the depth psychologies that believe that there's a value to self-awareness, and that this could be something worth seeking. And a lot of times, similar to what we talked about with meaning, a lot of times as self-awareness comes about, it's going to bring about healing. It's going to bring about the alleviation of symptoms. It's going to bring about an ability to respond differently. And so self-awareness can lead to happiness in an indirect way. But it also can be, I think, a valuable in and of itself. Just for some examples of that, I will often make the comment that one of the best gifts that you can ever give to your future kids, if you're not already a parent, is to be in therapy before you have children. To start to become aware of yourself, become aware of your patterns, that this allows you to be able to start to respond differently and think about things differently. I was very blessed that this was one of the things my parents really emphasized to me, that they were pretty good parents, but yet they still said, hey, you need to really take a close look at how we raised you and how it impacted you, and then make your own decisions about how you want to live your life and parent. And they said this in a variety of different ways, and it was, I'm sure, quite impactful in my decision eventually to seek a career as a therapist. Moral and ethical reasons. This again can connect back to some of Frankl's ideas about the idea of living well can lead to greater meaning, greater happiness, greater spiritual depth. So looking at the moral implications, and this is not um, just about how to follow the rules, but how to really look at your own understanding of what's right and wrong, your own understanding of your values and how to live in accordance with your values that you have thought through well. That can be something that can be part of a deep healing process. Relational healing is another one we can talk about, and of course, this is something that's addressed in all kinds of different mediums today, that it's a common reason people go to therapy. There's workshops and coaching about improving your relationships. A lot of religious organizations and churches will regularly offer trainings and different things on improving your relationships. So there's a lot out there about relational healing. And a lot of these tend to talk about how to be more effective in your communication, different things along these lines, which, those can be important things. But often they neglect this idea of a greater depth in one's relationships. How do you develop a deeper relationship with each other? Which is something that often is what a lot of people really would like, much more than just being able to communicate more effectively. So various ways of looking at relational. And then social, cultural, and communal, looking beyond the individual. How do we heal groups? Or how do we engage in healing through groups and of groups? So one of this can be, like support groups and group therapy, where we get help people to do their own healing in this group setting. But really what I'm talking about more here is how do we heal these social levels, these cultural levels, these communal levels? Let me give a couple of examples here. Less than a week before I'm giving this was the shooting in Connecticut, where 20 children were killed and a number of adults were killed in a school shooting. How do we help heal that community? How does someone go in and help heal that community? I think that's one part, an important question. Another way that we can talk about is, what about displaced communities? I recently was watching a documentary, the Darfur Diaries, that talked about a lot of the individuals that were displaced from their homes in the Sudan. How do you work with individuals who have been on a collective level like that displaced and work through the healing process? A few years ago, we had a presentation at school I was teaching at the time on the contemporary effects of slavery, of the history of slavery in the United States. And again, there's still a lot of healing that needs to be occurring about what has happened in the United States history. And there's a lot in the United States history that we could talk about with this. The history of slavery, the history of how Native Americans have been displaced and treated. There's a lot of very painful history that continues to impact individuals. How do we work towards healing on those levels? And these become very important questions too, and other ways of looking at the healing process. Okay. Then how do we assess effectiveness? Now, let me talk just real quickly about how we can talk about effectiveness in the field of professional psychology. Carl Rogers often isn't given credit, but he was the first person really to look at the effectiveness of therapy, and he did it in a very intensive way by dissecting videos and audio recordings and transcripts of therapy sessions and looking at the impact of different communications, different interactions. So in many ways, I think we can talk about it. Carl Rogers really is the father of psychotherapy effectiveness studies. However, it was in the late 80s and early 90s that the empirically validated treatments really started to come in, and that they quickly turned to the empirically supported treatments. These two are really quite similar here, and these were looking at an approach to understanding effectiveness based on random clinical trials that we're looking at therapy outcomes. Typically, the outcomes were very prescribed as far as what the person should want, the alleviation of symptoms from a particular diagnosis. So it was very narrow, but this was, in its understanding, but this was the dominant way of looking at therapy effectiveness for some time. And then this began to change in the mid-90s to evidence-based practice. And really when Ron Levant was president of APA, we started to see that his task force, presidential task force on evidence-based practice in psychology, started to switch to evidence-based practice, which is now the current zeitgeist in psychology. This is a much broader understanding of what is effectiveness in psychotherapy that takes into consideration various factors in looking at whether something is an evidence-based practice. Is there a research base? And research is understood much more broadly, whereas in the empirically validated treatments and empirically supported treatments up here, the randomized clinical trials were really used as the gold standard. In evidence-based practice, there can be various different types of research, including qualitative research, so it's much more open in that regard. Expert experience, what do experts who have worked with clients for many years, their input is considered valid, whereas previously in empirically validated and empirically supported treatments, that wasn't considered as anything worth considering. And then consideration for individual differences, which can also include the cultural differences. Can the therapy work with individuals from a variety of different backgrounds? And that also is a place where we can start to input the idea of different possible outcomes to therapy. So that's also an important new thing in evidence-based practice. In humanistic and existential psychology, a lot of people still are very cautious about evidence-based practice, and there's some reason to be. And particularly, even Ron Levant early on warned that if we didn't work to define evidence-based practice clearly in a new way, that we were going to see that the way it was understood would regress back to basically being the same thing as what we've seen in the empirically supported treatments. And I think that has happened to some degree. However, evidence-based practice really does open up a lot of different ways of conceiving this, and I think we need to continue to work to have a strong basis for a broad understanding of what evidence-based practice is. More recently, then, we see that the treatment guidelines have started to come out over the last year, which has concerned some again. But a variety of us with the Society of Humanistic Psychology actually had a meeting with the committee that is in charge of the treatment guidelines at APA, and in the conversation with them, really found that a lot of the fears that were about misconceptions about what really was going on here. It's not just a move back to the empirically supported treatments again, as some people feared, although there still is some potential to worry about that, to stay on the outlook for it is the same with evidence-based practice. But again, we start to see these are a little bit more broad conceptions of how to understand effectiveness. But throughout most of the history, and there's still a lingering impact, the dominant voice has often been much in line with this empirically validated treatment in which it was dictated what should be done in therapy, what should be accomplished in therapy, etc. So now we start to see that there's a lot of outcome measures introduced in psychology. Some of these are encouraged to give on each session or every few sessions, very standardized paper and pencil approaches. Some of these look at symptoms, some of these look at the therapy relationship. I think those have their place. Personally, I think there's also limitations to them from someone that practices from a very relational and existential model. And I prefer to try and do the evaluations in the therapy relationship, in conversation, instead of through these more standardized measures. However, I do think that there certainly, again, is a place for these and looking at them. And what is important here that I think is missing quite often in these conversations is that there can be different ways of doing this that are appropriate, and we should consider how to assess effectiveness based on the type of treatment and upon what the client is looking for. There are some times that these standardized approaches just don't make sense. They don't fit, and there's times where they're a much better fit than the relational approaches. So we need to see based on the context, and so we need to consider the healing approach and context, I think, is the key. And so we go through some of this history, not to say that these are the right ways to do it, but rather to say, let's see if we can look beyond these. Let's look beyond them and see if there's other ways that we can really conceive of and conceptualize effectiveness.